Welcome to Who We Become, Life Beyond Change. I'm your host, Amanda Lentz. This is a space for honest conversations about identity, resilience, and what it really means to rebuild after life changes. Here, we share stories of loss and hope, of challenge and courage, and of becoming someone new, even when life doesn't go as planned and the future feels uncertain. Whether you're navigating illness, grief, transition, or simply searching for meaning after change, you are not alone here. And I'm so glad you're here. Let's begin. Today on Who We Become, we're joined by someone whose story sits at the intersection of medicine, motherhood, and the deeply human work of rebuilding a sense of self after everything changes. Dr. Buckheit is a physician who has spent her career caring for women, guiding them through pregnancy, birth, and some of the most vulnerable moments of their lives. But a few years ago, her world shifted in a way she never expected. She went from being the doctor in the room to being the patient fighting for her life. A sudden medical crisis, sepsis, and a preterm birth forced her into a season where expertise couldn't protect her, control wasn't possible, and identity had to be rebuilt from the inside out. Today, she's here not just as a clinician, but as a woman who has lived through the rupture and who now brings that lived experience back into the way she practices medicine. We're talking about what it feels like when your body becomes unpredictable, what happens to identity when the roles you've always held fall away, and how you begin to trust yourself again after trauma. This is a conversation about women's healthcare, the emotional realities we don't talk about enough, and the quiet, complicated work of healing. And it's also a conversation about becoming, about who we are on the other side of the moments that break us open. I'm so honored to welcome Dr. Buckheit to the show. Thank you so much for joining me today.
Thank you, Amanda. Thank you for having me. And that was such a beautiful introduction. I really appreciate it.
Of course. Well, I'd like to start off, if we could, by going back to the beginning. If you could start at the moment where everything shifted for you, can you take us back to that time in your life?
Yeah, so I was a fourth year resident in my OBGYN training, and I was pregnant with my second child. I was 27 weeks, and I was, in the spring of my chief year, which is a really busy and exciting time in training. I came down with what I thought was maybe either the flu or COVID. I just didn't feel well. Um, but my fever kept getting higher and it just seemed different. I had all the resources imaginable being a resident at a tertiary care medical center. I was at Duke at the time. Um, and I was texting the maternal fetal medicine fellows and asking what I should do next. And we all came to the unfortunate conclusion that I should go to the dreaded OB triage, which is the last place you want to end up. I mean, I think any pregnant patient, really, unless you're going into labor, would want to end up. But as a resident, especially, you really don't want to end up there. And I went in and was much sicker than I thought. I quickly was meeting sepsis criteria. They got blood cultures, and 24 hours later, we found out that it was listeria that was making me so sick.
Oh my goodness.
Once they had me on the directed treatment for that, which is ampicillin, um, because it was effective at killing the bacteria, it also put my body into complete shock. And I was transferred quickly to the intensive care unit at Duke. And not long after that, the unfortunate decision had to be made to proceed with delivery for both my safety and for my baby's safety. And so we had a urgent cesarean delivery of a tiny 27-week baby, which was very much not my plan at that time. I thought I was going to ride off into the sunset on maternity leave with a full-term baby at the very end of my training, but this was a very different story.
Oh my gosh, I can't imagine it. Thank you for your vulnerability and being open to share your story, because I know this is not something that a lot of women talk about or feel comfortable about. So I want to stop and just acknowledge the vulnerability you're bringing, and the reach that you'll have and the impact you'll have by sharing your story.
No, of course. I mean, I think I'm, as a person, pretty much an open book. And I think I've found, at least in my healing journey, sharing my story and saying it out loud and going over what happened is part of the way that has brought me through and helped me understand and move forward in a way. So I appreciate that. But yeah, that's become, at least for me, been part of my journey.
Absolutely. And so you spent your training, you spent years being the one who holds space for others, who guides women through some of their most vulnerable moments, embracing motherhood or going through life changes. And so what was it like to suddenly find yourself being the physician to being the patient?
Yeah, I mean, I think I struggled with this a lot. And it's kind of almost comical thinking back on it now, how I was trying to maintain my role in a way of like, that I had control in some
Yeah.
regard, right? I remember coming into OB triage and like the intern comes to see you when you're in triage. That's how it works in an academic medical center. Usually it's a triage staffing OB triage. And she came in and I was like, okay, well, we need a urinalysis. We need, a CBC. We need a respiratory viral panel. Like that we need an NST. Like this is what we need to do. Like I was kind of had my whole workup in my head. And it was the intern that was like, well, Callie, like you're actually meeting sepsis criteria. Like I know you think you know what's going on, but like it's different. And so she really made a huge difference by like advocating for blood cultures early on. And I really credit her to doing such a good job. And it was like if I had really clung to that identity as being the one in the driver's seat, I think I wouldn't have gotten as good care. But so it was definitely a moment of kind of letting go and many moments of letting go over the process of my illness. Um, but I think the other thing it helped me really come to understand is whether you're a doctor or a lawyer or a business professional or anyone who is in the medical system with whatever background, when you're going through acute illness, you are not at your kind of intellectual best, if you will.
Course. Yeah.
And so looking back, I'm like, I was trying to get myself discharged from triage when I was like exceptionally unwell because in my mind with my poorly perfused brain from hypotension like thought that made sense, right? So it's like all of us when we are very very ill, we're not at our intellectual best, and so there's this letting go, and you put a lot of trust and faith in medical professionals that of course, sure, I know that on an intellectual level as a doctor, but I think being the patient and going through that experience, perhaps even more intensely so, really, really gave me that perspective.
Absolutely. So I know that transition from, having to let go, you had just shared, and from expert to just, a vulnerable patient must come with some sort of identity whiplash a bit. So, as someone who was in fourth year residency with deep medical knowledge, how did it feel to experience something so unpredictable and life threatening once you learned what it was that your body was fighting?
I mean, I think, and this may be jumping ahead a little bit, but I think for me, this whole experience was so hugely difficult to rationalize and hold on to all at once when it came to identity because I had until that point really defined myself as being this like hyper competent OBGYN doctor who can do it all. Like I'd had a child as at the end of my intern year, and I have an incredibly supportive husband who really made that possible with like childcare and all of that. But at the same time, I was working sometimes 80 hours a week as a resident. I pumped for my child. I provided breast milk for 12 months while still being at like the top of my game, being the top of my residency class. And I think that was really how I came to define myself. And so by the end of my fourth year, I was like, wow, like I've done it. Like I've been able to do this training program that's so rigorous and do as well as I want to do. Um, and then all of a sudden having just the rug ripped out under me and like all of a sudden just physically being unable to do what I thought I would always be able to do. That kind of like do it all mother professional identity that I had was just absolutely not a reality anymore.
Wow. I can
I was really proud of that, really proud of that accomplishment. I mean, I think it is a big thing. And I had amazing mentors and role models who showed me that was possible. And I was like excited to kind of join that cohort of women in medicine in this era where women are really like, hey, like I'm going to pump in the workroom and I don't care if that makes anyone uncomfortable, like this is what's happening. I'm doing my job and I'm being a mom. I was really proud of that identity. And so I think being incapacitated and then having a baby who was incredibly ill and premature and in the NICU and having to be a NICU mom when I went back to work, it just was a totally different beast. And that was really hard to reconcile for me.
experience.
I think, I think that duality where you're basically living any working mom knows that there's this like double life you lead where you're like I'm a professional and I'm a mother, and those I try to meld those both together as best I can, but I'm living this double life to a certain extent. I think being a NICU mom and recovering from any type of severe medical illness or surgery or that type of thing, it just brings that even more acutely into focus, and I think it feels just very difficult to do both things and be both things. It feels really impossible early on. And I think what I tell people who I know who are going through this or patients is just like taking it one step at a time, and that it won't be this hard forever. Um, but it's okay to feel like it's really hard because it really is. This this question you ask kind of makes me think about an experience that I had again and again going back to work after an event like this and with a baby still in the NICU, that there was this pressure I felt to act like everything was okay because I was well enough to be working and my baby was stable enough in the NICU that didn't have to be at her bedside every hour, right? And so on the outside, it kind of looked like this success story, right? Like you both survived this insane situation. You're both doing well. Like everything's okay. Like, how great is that? Well, at the same time, I was feeling like very much not okay. But when people ask, like, how are you? How's the baby? It felt to me like all they really wanted to hear is everything's okay. Right. And it was just so hard every day to answer those questions and like be around people who are very well meaning, and just feel like everything's really not okay.
Absolutely. And that's the goal of having these conversations is to bring light and bring awareness to the after. You
Hmm.
on the surface, you look good. You're back at work. Your
Yeah.
baby's doing well, but inside you have transformed into someone completely different. And
Yeah.
it's hard. I think it's hard for people to reconcile that as
Yes,
well.
and I think it's that duality of and that, holding multiple things at once where it's like
Absolutely.
on the one hand, yes, like we survived, we're doing well, everyone's alive, like and we're so grateful and we're so happy. But yeah, that I think it's hard for us as individuals, but especially hard for people from the outside looking in to understand that like both things can be true. Like yes, and like yes, you're okay, but you're also a trauma survivor, right? Or like yes, you're
Absolutely.
okay, but you're still recovering physically and emotionally. It's like yes, and I think that I hope your podcast and all the things we're doing bring light to that because that's huge and it lasts a long time and it lasts a lot longer than the acute event.
So thinking back to that space, it's just thinking about those who may be in a caregiving role, or who may be um, aware of someone who's been through some sort of traumatic event. What would you say to them? Like, what would have helped you in those moments to make you feel more seen? Or is there anything that someone could do that would have changed your experience?
I mean, I think that one thing I find myself saying to people because I think I wish it had been said to me more is that it's okay not to be okay.
Oh,
I say that a lot. Or people will say like, it's so, say, I'm so sorry that you had like this morning, I was rounding on a patient. I'm so sorry that you had this emergency C-section. Like we didn't know that was going to happen. I'm so sorry that happened. And the patient says, it's okay. And I'm like, well, it's not okay. Like it sucks. It sucks. It's not okay. But you're here and I'm so glad you're here and I'm so glad you both are safe, right? That type of language. Like I find myself using that type of language instead of minimizing it in a way, whether, and again, I don't want to sound like people were cruel to me, right?
of
Not at all. Like
course.
people are very well meaning, but it's just that I think recognizing like this person is probably not really okay, right? Everything is not fine. Um, but we're glad that people are safe, right? We're glad that you're recovering and we're happy you're here and I'm supporting you in your recovery, right? More language like that, I think is more helpful.
Absolutely. No, and again, people are well-meaning. And I will
Yes.
say for me personally, before having gone through breast cancer and, lived that type of traumatic experience myself,
Yeah.
I would show up, "Oh, how are you? I'm so
Yes.
sorry that happened." And that
It's so good to see you back. Like, I'm so glad you're doing well. Like,
yes,
like, of course, right? Like, because we think that's the right thing to say. But I think when you're in it, you realize you're like, oh, that's really hard. Cause then it makes me feel like I have to perform that for you. You know,
absolutely.
that's, yeah,
Yeah. And so I think conversations like this too help educate others who may be who want to help. There's no shortage of wanting to help, but what's the right way to show up? How are you going to be most helpful?
right.
Um, and so, as a physician, you see women go through all sorts of changes with their body from emergencies, cesareans that you just recognized to
Mhm.
menopause to, you know, I'm sure fertility issues. I'm sure it runs the gamut. And so I think a lot of women listening will understand this is just reconciling with your body. So how how do you come to terms with that, or what was your experience like having lived through this traumatic experience of sepsis and a preterm birth? Like how did you begin to trust your body again, or what did that look like?
Yeah, I think initially, and I think this is a very normal response, and I will tell patients when they express this, it's a normal response, feeling like your body kind of betrayed you or failed you in a way, right? Like, why couldn't my body do this? Why couldn't my body handle this infection? Why did I have to get so sick? Or with my first child, I ended up with a C-section. Like, why did my body fail to have a vaginal delivery? That feeling like your body didn't do something it was supposed to do. Um, but I think I've moved from, at least in my own recovery and journey of healing, like from a place of feeling like my body failed me to a place of recognition of how strong my body is to have even made it through what it
I
made
love that.
made it through. And like I even like this is kind of like a lighthearted, thing that I notice about myself. So I do Orange Theory for my one of my workouts that I like to do, and they'll have you do these really challenging, runs. You're on an incline. You do an all out a sprint, and it's hard. And there's like a big mirror in front of the treadmills, and sometimes I'll like look at myself in the mirror and I'm like, I don't know if I can do another minute at this pace, and I'm like, but you survived sepsis. Keep going.
Ugh,
you
yes.
know so it's like changing that narrative of like back then I was like, wow, like my body's the worst, like what the hell. And like why did it couldn't hold it together. But now I'm like, no, like your body's like strong as hell, like you made it through that's ridiculous, and you can definitely do this the rest of the mile. So I think for me in my recovery, that's something that I've taken away. Yeah.
That's amazing. Being able to reframe something that was so incredibly hard and challenging to say, you know what? I beat this. I can do anything. Heck yeah, I
Yeah.
can run another mile, or you know what? I can lift another pound more than I did yesterday. It's just reframing your body from being broken, like you said, or have failed, or that initial like, oh God, like what's wrong with me? You know what?
Right.
I've lived through something so
So much harder than
yes.
yeah, I have lived through harder things. I have done harder things. Like you're going to make it through. And I think it's so hard. I mean, preterm birth, like the infection aside, just preterm birth feels so bad. It feels so hard as a woman to see this tiny baby that you're like, God, if only I could have grown it inside better, like it's so hard. But I think I don't know what the right answer is. I think the right answer is you take it hour by hour, day by day, and it's not going to be this hard forever. And eventually you're going to be able to look at you and your baby and see you and your child for the amazing hard work that the bodies did, right? And not for some type of failure. But I think in the moment it's real, that prematurity is really, really hard to see and to live.
Phew. Well, I'm glad you're on this side now and you're able to advocate for others and share your story and help others feel not quite so alone.
Yeah.
And so you've seen women's health from both sides now, both, the clinical side and deeply personal. And what do you think women are experiencing physically and emotionally that isn't being talked about enough?
I think one part is that reconciliation and like that becoming whatever new identity the season requires. I think that is happening behind the scenes for over the course of women's lives. One thing my mom's in her 70s. She had me when she was 41, and she always says, she says, as women, we're lucky to have seasons. We have all these many seasons in our body and in our lives, right? Where you have different seasons. You have your childbearing seasons, you have your breastfeeding season, you have your life when your kids are growing up, you have your older body, like you have all these different seasons. And I think having that perspective is helpful. And but we're constantly integrating that, right? You're living in your pregnancy body, and then your postpartum body, and your breastfeeding body, and your raising children body. Like these are all different. And then your perimenopause body and your menopause, like it's just there's so many different seasons that we work through as women. And I think we all are integrating that and creating and recreating our identities through that all the time, below the surface, that no one knows about. But I think that's the nature
Absolutely.
of being a woman.
I love that. I love, it's a season, right? Like you had referenced earlier, it's not going to be this hard forever. So whatever season you're in, there will be a new season. There will be
Yes.
another period of time where you'll look back and you'll be able to hopefully draw strength from whatever it was that you've gone through in that particular season.
Yes, I had friends visiting me this past weekend, and they have a 2.5-year-old. My youngest is now 4, the X 27 weeker. But I was watching them parent a 2.5-year-old, and I maintain that 2 is the hardest. I think 2 is the hardest,
100%.
hands down. And I'm watching them parent this 2-year-old, and I'm like, wow, that is a season. like, and I'm so happy I did it, and I'm so happy I'm not in it anymore. You know?
Oh, yes.
Yeah.
Mine are older now. My youngest is now almost 7, but
Yeah.
my siblings all have little ones. And I'm like,
Yes.
I loved it while we were in it, but
Yes.
like, here's a crying baby back. Like, now
Yes.
I'm going to go shopping with my oldest.
Right. Feel like I love how I was able to redirect your 2-year-old and get her out of that tantrum. And I'm so glad I don't have to do it 15 more times today. That is so great.
That is so true. You appreciate it. You don't fully understand it, I think, while you're in it, but looking back, you're like, whew, conquering the twos is hard.
It's
And you did
hard.
it. You lived through
Live
that.
to tell the tale. Exactly. You're stronger for it.
And so what does life look like for you now? 4 years later with your youngest being 4, what does life look like for you?
So my youngest, she was in the NICU for 103 days, and she came home with a feeding tube. So she had a gastric tube or G tube, and she had that for 2 years, where she was getting supplemental nutrition through that. She developed an oral aversion in the NICU where she actually wasn't able to eat by mouth for a full year, because of just the negative stimuli that happens in the NICU, and some premature babies just develop that. So it took a long time to learn how to eat and all those things, but now you would never know. She just has a little G-tube scar, and she eats well, and she's growing, and she's in preschool. So we're very happy. And then my older child is 6.5. She's in first grade. And I finished out my training at Duke and joined one of the private practices in Raleigh. We're the largest private practice in the area, and I'm now a physician partner in the group. So it's a busy, wonderful time in life.
And how, I know the way that we connected was through social media. And I
Yes.
just have to say, I am so thankful that you are out there and you're accessible and you're talking about women's health that, wasn't around even
Yes,
5 years ago.
I
And so,
know.
so for someone who's looking to get connected with you or just, learn more about you, your practice, how can they find you?
So I am on Instagram and on TikTok and Threads. I'm at Callie B MD, and I really have come to love social media as just a side thing that I do outside of my, office hours. I started doing work on social media because I realized pretty early on in private practice just how much information my patients were getting from social media about women's health topics. And almost felt like a duty to be a positive, evidence based, accessible voice in that space of putting women's health material out there online on social media. And it's been fun to do so. And it's been fun to connect with patients outside of the clinic, right? So I have a lot of the people who follow me are actually like my patients or patients of my practice. And so getting to connect with people on a different level, and then I find new and interesting people like you, getting to connect with other women's health advocates online. So it's been really positive, and I would love to connect with anyone on social media.
I just want to thank you for your honesty, your vulnerability, and your willingness to share your story and help others feel not quite so alone, especially as they navigate different seasons, which I love.
Yeah.
And so, your story is a reminder that even the people who care for us, the ones we trust with our bodies and our lives, are human too. They break, they fear, they lose control, and they rebuild. And sometimes their own lived experience becomes the very thing that reshapes how they show up for others. And so, what you shared today pulls back the curtain on something we don't talk about enough: the emotional and identity level impact of medical trauma, the way a crisis can fracture your sense of self, the way your body can feel like a stranger, and the slow, non-linear work of learning to trust it again. Your honesty gives language to what so many women feel but rarely say out loud: that healing isn't just physical, it's psychological, it's relational, it's identity shifting, and it deserves to be treated with the same care and attention as any clinical recovery. So, if the story today resonated with you, or if you're navigating your own version of rebuilding after a health crisis, I hope this conversation reminds you you're not alone. You are allowed to grieve what happened, and you're allowed to become someone new on the other side of it. So, Dr. Buckheit, thank you so much for your vulnerability, your wisdom, and the way you're changing women's healthcare from the inside out. And for everyone, thank you for listening. This is who we become.
Thank you so much, Amanda.
Thank you for joining me today on Who We Become. I hope this conversation reminded you that growth isn't always easy, but it is always meaningful. If this episode resonated with you, please share it with someone who might need it. And if you haven't already, be sure to follow, rate, and review the show. It truly helps these stories reach those who may need a reminder they are not alone. Remember, what happened to you is part of your story, but it is not the end of it. You are not defined by what happened to you. You are shaped by how you rise. Until next time, take care of yourself and keep becoming who you're meant to be.